Have you noticed small but worrying changes in someone you care about over the past year? A lot of folks think that passing in old age happens out of the blue. But the truth is, the body often gives us quiet signals months, sometimes even a year, before life reaches its final chapter. The trouble is, these signs can seem so minor that we overlook them. It's only when we look back that we realize the clues were there all along. But by then, it's often too late to prepare or make those last moments count. In this video, we're diving into 5 key signs that often show up in the final year of an elderly person's life. Some might be things you've noticed, but chalked up to just getting older. Others might seem small, but are actually red flags of the body slowing down. Spotting these signs early gives you a chance to provide better care, cherish precious moments, and, most importantly, ensure your loved one's final days are filled with comfort, dignity, and peace. Stick with us until the end, because these insights can help you prepare emotionally and practically for what's ahead. When you know what to look for, you won't be caught off guard, and you can make the most of the time you have left with those you love. If you find this helpful, drop a number 1 in the comments to let me know you're here, and don't forget to subscribe and hit the bell so you don't miss any of our videos. Let's get started. Sign 1. Significant weight loss. The first and one of the most noticeable signs is unintentional weight loss. You might notice your loved one's clothes fitting looser, their belt needing an extra notch, or their appetite just isn't what it used to be. Many families brush this off as a normal part of aging. But here's the thing. Losing weight without trying is rarely a good sign. This often means the body isn't absorbing nutrients as well anymore. Muscle mass starts to shrink, and the body's essential systems begin to slow down. Sure, aging naturally leads to some muscle loss, but when it happens too fast, it's a signal something deeper is going on. The body might struggle to digest food properly or process proteins, leading to muscle wasting. This doesn't just make moving around harder. It increases the risk of falls, weakens the immune system, and leaves them more vulnerable to infections. Another factor is a change in appetite. Many seniors stop feeling hungry like they used to. Their sense of taste fades. Food doesn't seem as enjoyable, and they might skip meals or eat much smaller portions. This isn't just them being picky, it's a physical change. As the body starts to wind down, it stops sending strong signals to the brain to seek out food. The result? Less energy, less strength, and a slow decline in overall health. Underlying health issues like cancer, heart failure, or kidney disease can also cause weight loss, often long before more obvious symptoms show up. Even conditions like depression or memory problems can lead to less eating, creating a downward spiral where the body doesn't get enough fuel to keep going. If you try encouraging them to eat more, maybe cooking their favorite meals or offering protein shakes, but the weight keeps dropping, it's time to recognize this isn't just about diet. The body is preparing for a bigger transition. Instead of pushing big meals, focus on comfort. Offer easy-to-eat foods, keep them hydrated, and create a warm, caring environment. If you notice your loved one losing weight, eating less, feeling weaker, or struggling to stay active, pay attention. It's not just about how they look, it's the body sending a message. Understanding that message now can help you face what's ahead with clarity, compassion, and the ability to make every moment count. Sign 2. Extreme fatigue and weakness. The second sign is a deep, persistent tiredness that rest doesn't fix. This isn't just feeling worn out after a long day. It's an overwhelming exhaustion that makes even simple tasks feel like climbing a mountain. Getting out of bed becomes a struggle. Walking across the room takes effort. And things they used to do without thinking, like cooking, getting dressed, or chatting, start to feel draining. This isn't just aging at work. As the body's organs slow down, it starts conserving energy for only the most essential functions. The heart doesn't pump as efficiently, blood circulation weakens, and muscles don't get the oxygen they once did. This is why many seniors in their final months feel weak, unsteady, and unable to keep up with activities they used to love. Another piece of the puzzle is a metabolic slowdown. The body, which used to produce and use energy efficiently, now shifts to preservation mode. Instead of fueling activity, energy is redirected to keep vital organs going. This is why your loved one might sleep more, need longer naps, or struggle to stay awake for long stretches. They might seem fine 1 minute, then completely wiped out the next. The hardest part? The emotional toll. Many seniors who prided themselves on their independence feel frustrated, even embarrassed, that they can't do what they used to. They might pull back from conversations, avoid social gatherings, or stop enjoying hobbies. Not because they don't care, but because they just don't have the energy. This can lead to isolation, which only speeds up their decline. For families, watching someone go from active and engaged to exhausted and withdrawn is heartbreaking. It's tempting to think they're just being lazy or need to push through, but forcing activity won't help. What matters is respecting their limits, letting them rest when needed, and making their days as comfortable as possible. If you see your loved one dealing with ongoing fatigue that rest doesn't fix, it's a sign their body is going through a major shift. This is the time to cherish quiet conversations, create moments of peace, and support them without expectations. It's not about what they can do, it's about them feeling loved and understood. If you're still watching and finding this helpful, drop a number 2 in the comments to let me know you're with me. Sign 3. Cognitive decline or emotional withdrawal. As someone nears the end of life, one of the most striking changes is how they think, communicate, and connect with others. You might notice that someone who was once sharp starts forgetting things more often, struggles to follow conversations, or seems confused in familiar places. They might repeat themselves, forget names, or lose track of time, even if they never had memory issues before. This isn't just normal forgetfulness. The brain, like any organ, needs a steady supply of oxygen and nutrients to work properly. As circulation weakens, the brain gets less of both, leading to cognitive decline. Your loved one might get easily confused, struggle with decisions, or even have trouble recognizing people or places they've known for years. Sometimes, they may have brief moments of clarity, only to slip back into confusion, like their mind is flickering. Another sign is emotional withdrawal. They might speak less, engage less, or spend long stretches just sitting quietly. It's not that they don't care about you. It's that their brain isn't processing emotions or social interactions the same way. Conversations become exhausting, noisy settings feel overwhelming, and many seniors retreat into their own world. You might also notice mood changes. Some become more irritable or anxious. Others seem unusually calm or detached from things that once mattered to them. This isn't a personality change. It's the brain adjusting to the body's decline. For families, watching someone lose touch with reality or pull away emotionally can feel like losing them before they're gone. It's tough, but they can't control it. Instead of trying to pull them back into long conversations, meet them where they are, speak gently, offer reassurance, and know that even if they don't respond, they can still feel your presence. If your loved one is getting more forgetful, confused, or disengaged, don't ignore it. These are signs their body and mind are preparing for the final transition. Be patient, cherish quiet moments, and create a safe, familiar space where they feel at peace. Even when words fade, love and comfort still get through. Sign 4. Frequent infections and slow healing. As the body starts to wind down, one clear sign is a weaker immune system. Someone who rarely got sick might now catch every cold, flu, or minor infection going around. Illnesses that used to be no big deal now take much longer to recover from, and even small cuts or bruises heal much slower than before. These changes aren't random. They show the body can't defend or repair itself like it used to. Repeated infections, like pneumonia, urinary tract infections, or skin infections, become more common as the immune system weakens. Families might think these are just one-off illnesses, but when they keep happening or linger, it's a sign the body is losing its ability to fight back. Even antibiotics, which used to work quickly, might not be as effective anymore. Your loved one might need stronger drugs, longer recovery times, or multiple treatments for infections that would have been minor before. This happens because slower circulation and declining organ function make it harder for the body to respond to treatment. Chronic wounds are another issue. If small scratches, sores, or bruises don't heal properly or keep reopening, it can mean poor blood flow is preventing oxygen and nutrients from reaching the skin. For those who are less mobile, pressure sores are a serious risk and can lead to dangerous infections if not managed carefully. What's trickier is that infections in seniors often don't look like we expect. Instead of a high fever, they might just seem more tired, confused, or less interested in eating. In fact, a sudden drop in mental alertness is often the first clue of an infection, even before other symptoms show up. Watching your loved one go through repeated infections can be frustrating and heartbreaking. It's tempting to push for more treatments, hoping one more round of antibiotics will do the trick. But sometimes, the focus needs to shift from curing to comforting. Keeping them hydrated, their skin clean, and their stress low can do more for their well-being than another hospital visit. If you're still here and finding this helpful, drop a number 4 in the comments to let me know. Sign 5. Major changes in breathing or circulation. One of the most telling signs that the body is nearing its final stage is a change in breathing patterns or circulation. You might notice your loved one breathing more slowly or shallowly, with pauses between breaths. Their breathing might become irregular, speeding up one moment, slowing down the next. Some experience a pattern called Cheyne-Stokes respiration, where deep, rapid breaths alternate with long pauses. These changes may start subtly, but grow more noticeable over time. Weakened circulation is another key sign. Their hands, feet, nose, or ears might feel cold to the touch. Their skin may look pale, bluish, or mottled, especially around the fingers and toes. This happens because the body is prioritizing blood flow to vital organs, cutting back on circulation to the extremities. It's a clear sign the heart isn't pumping as strongly as it used to. Shortness of breath is also common, even with minimal movement. Sitting up, talking, or shifting positions might leave them winded. They might breathe through their mouth more or need to pause mid-sentence to catch their breath. If they used to walk across a room with ease but now struggle, it could mean their lung function is declining. In some cases, fluid buildup in the lungs makes breathing harder, causing a persistent cough, gurgling sounds, or chest tightness. While it's easy to mistake this for a cold, in seniors nearing the end of life, it's often a sign of weakening lungs. This can make lying flat uncomfortable, so they might prefer sleeping propped up with pillows or in a recliner. For families, these changes can be scary. You might want to urge them to breathe deeper or worry something urgent is happening. But often, this is just the body's natural way of slowing down. While you can't always reverse these changes, you can make them more comfortable. Keep the room cool, use a humidifier, or offer small sips of water. In some cases, medications or oxygen therapy can help, but the focus should be on comfort, not fixing the issue. If you notice changes in breathing, cold hands and feet, or a bluish tint to their skin, take note. These are signs the body is conserving energy and circulation is slowing. Be there for them, offer reassurance, and create a peaceful space where they feel safe and loved. Let's take a moment to reflect on what we've covered. Significant weight loss, extreme fatigue, cognitive decline, frequent infections, and changes in breathing or circulation. These are the 5 signs that often appear in the final year of an elderly person's life. They might not all show up at once, and they may not always be obvious, but when you start noticing them, it's a signal the body is preparing for its final transition. For many families, accepting these changes is tough. It's natural to want to fight them, to encourage your loved one to eat more, move more, or push through exhaustion. But sometimes the best thing you can do is listen to what their body is saying. Instead of trying to reverse the inevitable, focus on making their time as peaceful, comfortable, and meaningful as possible. Understanding these signs isn't about fearing the end. It's about being ready for it. Spotting them early lets you provide better care, make thoughtful decisions, and ensure your loved one's final months are filled with love and dignity. This is a time to cherish every moment, share stories, and let them know they're valued and never alone. If you're seeing these signs in someone close to you, take a deep breath. You're not alone on this journey. Knowing what to expect can help you find strength, patience, and peace. Thanks for watching today. Drop a comment below and share one thing you learned and how you'll use in your life. Your thoughts mean a lot to us. If you found this video helpful, please hit like, subscribe, and share to support our channel. We'll see you in the next one.